This video is about disposable glove use for patient care activities in the home. These gloves are clean, not sterile. They are used one time, then thrown away. Disposable gloves can prevent the spread of germs that cause infection. They are used to protect both the caregiver and the patient, even if the patient is a family member. Gloves work best when hands are washed before and after use. Always use gloves when touching anything that is wet or dirty from the patient's blood or other body fluids, including urine, stool, vomit, and mucus. Some examples of when you may come into contact with body fluids are caring for an open wound and cleaning patient items such as their bedpan, bathroom, and laundry. Start all care by washing your hands with soap and water for 20 seconds and dry them. Pull a glove out of the box. Hold the top edge of the glove with one hand to keep it open, then slide it onto your other hand. With your gloved hand, pull another glove out of the box. Hold the top edge and slide it onto your other hand. Push between your fingers to make the gloves fit correctly and comfortably. No parts of your hands should be showing. You should remove your gloves when the care is complete. If the gloves are dirty and you need to touch something clean, and if you get a hole in your glove. When you take the gloves off, do not let the fluid or dirt touch your skin. To take the gloves off, hold the top edge of one glove. Pull the glove down and off of your hand, turning it inside out. Continue holding it in the hand that still has a glove on it. Slide your ungloved fingers under the top edge of the other glove. Don't touch the outside of the glove. Pull the glove down and off over the dirty glove you are still holding. One glove is now inside the other with all the germs and dirt. Drop the gloves into the trash. If the gloves are bloody or contaminated, put them in a sealed plastic bag before dropping them in the trash. This protects the person handling the trash. Finish care by washing your hands with soap and water for 20 seconds and dry them. Using gloves incorrectly spreads infection when hands are not washed before they are used, when clean items are touched with dirty gloves, when gloves are not changed before moving to the next care step, and when hands are not washed after the gloves come off. Gloves are usually not necessary for routine care if there is no risk of contacting blood or body fluid. This care can include taking a blood pressure or temperature and giving medication. This video is intended as a tool to help you better understand the care instructions that you have been given. It is not intended to replace any specific advice or personal care instructions that you have received from your care team. If you have any questions or problems, please be sure to call or be seen.